When we talk about art, if we focus in on art rather than place and space, you can ask two questions about art, of how it can help you heal. And there's big differences. One is creating art and the other is viewing art. And for those artists in the audience, I think part of the beneficial effect of creating art is it gets you into a kind of a meditative state. Takes you away from the rest of the world. You focus your attention on the here and now. And that's different from viewing art, although I think viewing art has some of those elements in it. So there are a number of studies that do look at whether viewing art can help heal. And most of these studies look at amount of medication that is dispensed, symptoms that occur. So in surgical procedures, there's a study that showed that there was better pain control, less pain medication needed. In cancer chemotherapy, less fatigue, less distress, less anxiety. In psychiatric patients, less anxiety, agitation, and less medication needed. These are pretty remarkable effects just from looking at art. This is an example of a study that was done by Professor Sean McCann at Trinity College Dublin in Ireland. Sean McCann founded the first and only bone marrow transplant unit in Ireland. And this is the unfortunate view out the window that those patients have. When you are getting a bone marrow transplant, you are in a room for 6 to 8 weeks. It is positive pressure, sterile, so that your immune system is completely protected from any germs that might come in from the outside. So you're isolated. People cannot come in, you can't go out for 6 to 8 weeks. And this is what these patients were looking at. And the reason is because Trinity College Dublin is in a 200-year-old, what used to be a Dickensian workhouse 200 years ago. So Sean McCann had this problem of could he help his patients in that horrible setting. So the first thing he did was he hired an artist to talk to the patients and to create art, because he said he didn't have money, so he couldn't purchase art, but he could purchase paint for the walls. And so he hired an artist, and the artist talked to the patients, and this is what he came up with. Now, when I looked at these images, to me, it really didn't do anything for me. But apparently, these are the colors and the patterns of the football leagues across Ireland. So what it did is the patients then began to talk about football and their favorite football players instead of thinking about their pain. So that was his first step. And then he went a step further. He created what is called the Open Window Project, which in many ways is similar to what the Susan Sebastian Foundation has done here in Vermont. And I'll describe to you what Sean McCann did in Ireland. So he installed LCD projectors on the ceilings of these rooms. He couldn't hang art in these rooms because they have to be sterile and it has to be washed down all the time, and you really can't do that with art. So he installed these special LCD projectors that could be washed down. And then he projected images of art on the walls. He created a simple app so that even patients who were very sick and very weak could click on and choose, like you're choosing a TV station, the preferred scene or the preferred image that they wanted to see. They did this very systematically, just like the Susan Sebastian Foundation has done, which is that they had teams of multidisciplinary teams that included physicians, nurses, healthcare staff, artists, art historians, and they worked together to curate this art. It was both iconic art and modern art from current Irish artists who would send in images of their art as they were creating it day by day. So if you wanted to see the art as it progressed, you could do that too. And he came up with many different kinds of scenes. If you can imagine, this is the bed, the patient's bed, and this is one of the views that they showed. This is another, The Smoke Tree by John Gerard, who's a very well-known Irish artist. His work, actually, I think this image itself is a moving image, and it is in the Hirshhorn Museum in Washington, D.C. So when they looked at, when they interviewed patients and said, what would you like to see? The majority of them said they wanted to see views of nature. Sweeping vistas, cows and horses grazing. There's an image here on the wall of sheep grazing. There's sweeping vistas. There's views of nature. This is all what Susan Sebastian Foundation has done and is doing to put into these hospital rooms in Vermont. They also wanted to see pictures of family and loved ones. Some of them had individual reactions. So, you know, there are universally preferred scenes, but of course there's individual taste, and you have to take that into account too. There was one patient who liked to walk his dog on Dunleary Pier and watch the boats go by. So Sean McCann made an agreement with the City of Dublin to install a webcam on Dunleary Pier so that this patient could watch in real time the boats going by on Dunleary Pier. Another patient liked to watch the construction across the street from his apartment building. So they installed a webcam there and he could see the building go up across the street. So there are obviously individual tastes, individual preferences, but there are also universally preferred views. And in this study, Sean McCann found that patients who had the opportunity to be exposed to this kind of art had reduced anxiety, reduced depression, and better quality of life in their 6 to 8 week trial getting chemotherapy.